Welcome to the latest webinar presented by the CMT Association. My name is Rick Alber and I co-moderate one of the support groups out here in California. Today's webinar is entitled The Basics of Balance, and it will be presented by Kate Eichinger, who will share her knowledge and experience with CMT. Before the webinar starts, I'd like to apologize for the fact that this is not the complete webinar. We missed the first 20 minutes of the webinar because the moderator, me, forgot for the first time to press the record button at the right spot. Consequently, Kate begins with her 16th slide of 32, and we will continue from there for about an hour, including the rest of her presentation and questions from the attendees. You'll be able to see all of the slides that Kate presented, both before the webinar recording begins and during it. If you click on the slide presentation link on the CMTA resources website. Kate Eichinger is involved in the clinical care of adult and pediatric patients with neuromuscular diseases. Additionally, she is part of the neuromuscular research team and is involved in natural history studies and clinical trials involving patients with CMT, myotonic dystrophy, and facioscapulohumeral dystrophy. She has been involved with clinical evaluator training and assisted in preparing the manual for the pediatric assessment for the CMT natural history study. Her interests are in outcome measures, health and wellness, and balance. And with that, we'll start the webinar, as I said, about 20 minutes in.
Is considered a rare condition, so studies tend to be of small sample sizes, which limits the ability to detect differences between groups or to draw conclusions from the study. There are many different types of CMT, and even within the same type, there are still many different types of presentations of the disorder. So there are many different differences between individuals, which makes it hard to study as well. And then it's really hard to standardize the intervention. So I've said that the best interventions are designed to meet the needs of the individual. So to put everyone on an exercise bike to study it, the exercise bike may not be appropriate for all individuals, and the time that they may be on it or the intensity they may be on it may be different for each individual. So there's a lot of challenges in producing evidence that supports or looks at the safety and effectiveness of exercise and physical activity in individuals with CMT. My colleague James Nussbaum did an excellent review of this literature in the December 2013 webinar, so I don't want to repeat it here, but just so anyone that's interested, that is a place that you can go and listen to the different literature review on exercise and physical activity. There was one article, just to update it, that was not that was published this year in 2014 that looks at individuals with CMT, and it looked at 271 individuals, which is a pretty large number for this type of study. And really they concluded that there was no evidence of overwork weakness and that physical activity should be encouraged. Like I said, this is one of the larger studies investigating this area. But there still is not clear evidence. We have not published a Cochrane review, which is the most stringent type of review that will look at the effectiveness or safety of exercise, and that has not been done to this point. So there isn't 100% clear evidence, but I would have to say that myself, in my opinion, and like James, is that exercise and physical activity is good for individuals with CMT, but it needs to be prescribed on an individual basis through the evaluation of a healthcare team. I did want to make you aware that physical activity guidelines have been published by the Department of Health and Human Services, and they were published in 2008. And I gave you the link there to be able to go and look at them. and I will review the summary of them as well here. These are general guidelines for children, adolescents, adults, and older adults. They also recommend, though, that individuals with chronic conditions that aren't able to follow the guidelines perform as much activity as their condition allows, and to really avoid inactivity. So to review these guidelines and to summarize them for you, cardiovascular exercise is recommended to the individuals complete 150 minutes of moderate intensity exercise per week. Comes down to 30 minutes 5 times a week. And they recommend that episodes are at least 10 minutes long. And examples of moderate intensity exercise activities are things like walking briskly, biking, using a hand cycle, doing household activities like lawn mowing or shoveling snow, being out in the garden. Again, just 10 minutes at a time for each of those activities. And really, when they talk about a moderate intensity, they're talking about a level that you can continue to carry on a conversation, but you can't support singing. So you're not completely breathless, but you wouldn't have enough breath to sing. In regards to strengthening and strength training, the recommendations are 2 times a week, incorporating all major muscle groups, again at a moderate intensity, so 12 to 15 repetitions. There are different types of resistance that can be used. You can use gravity, so just the pull of the gravitational force. You can use water, which is the aquatic environment, either in a water aerobics class or just swimming, or just even walking in the water. Elastic bands can be a form of resistance. And you can use free weights or weight systems, machine type activities as well for strengthening. And you can look at it both doing functional strength training and machine-based strength training. And so I just wanted to spend a minute to talk about this. So functional training is training using movements that are encountered in everyday activities. So for example, it would be practicing moving from sitting to standing. With resistance or not. You can hold a weighted ball, you could hold free weights in your hands, versus an activity like using the leg press. So both of them are working the same muscle groups, just slightly differently. And functional training, in addition to muscular strength training, is thought to also strengthen the neural pathways in the brain for a particular functional movement. So things like doing a sit to stand is going to also strengthen the neural pathways that support that movement pattern within the brain. It may carry over to everyday activities better, and it may also assist with balance by engaging stabilizing muscles, or like the core musculature as well. That being said, in performing functional strength training, attention and care must really be given to proper form and proper joint alignment in order to minimize the risk of injury. And in individuals with weakness specific to a disease process, that alignment and proper form may be challenging. So there may be situations where using machines that assist with alignment because they are only moving in a certain plane may be a more appropriate and safer choice for individuals, versus when they're working with a physical therapist or working with a trainer who's watching for proper form and watching for good alignment. There may be situations where, when they're working independently, that the use of machines may be a better option. As far as stretching or range of motion and flexibility exercises, they recommend at least 3 times a week. In individuals who have muscle tightness or I guess muscle tightness or joint contracture or pre-contracture type situations, they recommend more daily stretching to be more effective. And so you want to hold stretches for 10 to 30 seconds and repeat 2 to 4 times to be able to attain 60 seconds of each stretch. You want the stretches to be light. You want to be in a position that you could hold for 2 hours if you needed to. Really intense stretching actually makes muscle fibers tear to some extent, and when the muscle fibers heal, they actually heal in a shortened length. So you really want to think about just gradually changing the flexibility of the muscle by elongating it. So a nice gentle stretch, and you also want to do this when the muscle is warm. So either after light cardiovascular activity or after a hot bath or a hot shower is a great time to perform stretching activities. I always compare it to the cold rubber band. So if I put a rubber band in a freezer and tried to stretch it afterwards, the rubber band would just snap, whereas a nice warm rubber band is much more pliable and flexible, and that's the way we want our muscles to be when we're doing some stretching. Dynamic stretching, such as yoga or different types of yoga, may also be beneficial in improving flexibility and range of motion, and can be considered for individuals with CMT. Again, there's no specific are you guys hearing me okay?
Yeah, we're not getting any reports of bad audio. Yeah, can you? We're not getting.
I'm getting experiencing network conditions.
We're not getting any reports of bad audio, so
Okay.
I think you can just go ahead.
Okay. So in general, thinking about safety when performing physical activity and exercise, the things that I would say are to choose activities that are appropriate for your fitness level and for your health goals. You want to increase physical activity and exercise gradually, so you start low and you go slowly as far as progression. Always want to use protective equipment, so if you're out on a bike, obviously using your bike helmet as well. As far as getting started with physical activity and exercise, obviously always consult your physician before beginning any new physical activity. But it's also important to have just a baseline evaluation of your strength, your function, your exercise capacity. And this helps prescribe the correct type and dose, if you will, dose being the frequency, the intensity, the duration of an exercise. So knowing where a person is at baseline helps us to make recommendations about how much to do during the exercise periods. We also have to take into consideration daily activities. So what are your family and work responsibilities? Are you sitting at a desk all day, or are you running around after a 2-year-old all day? So those play a role in how much additional activity an individual can take on. I think it's important to talk to people about your leisure interests. So if it's not something that you enjoy doing, the likelihood of you continuing to do it is pretty low. So always trying to incorporate individuals' leisure activities into their physical activity is helpful. And really, thinking about your overall health goals and your overall physical activity goals as well are things that we do when we're thinking about starting a new physical activity routine. We can also, through a proper evaluation by the physical therapist or your healthcare team, make recommendations to address the extrinsic factors of balance. So these include recommendations of bracing, assistive devices, and environmental modifications. So for a bracing standpoint, there is some evidence in the literature, not specifically in CMT, that bracing may assist with balance. The use of arch supports or foot orthoses has demonstrated improvement in balance abilities in older adults. And bracing may improve balance abilities in a couple different ways. They may improve the sensory input. So if you think of individuals with CMT who have high arched feet, they may have less of their foot in contact with the ground than other people would. So if you have a foot orthotic that provides sensory input across the entire foot, you may have more sensory input being received by the brain and helping with the position in space that a person is in. AFOs, or ankle foot orthoses, may do the same thing. They may have contact in areas with less sensory involvement and be able to provide increased sensory information. Bracing using AFOs may also improve balance by providing stabilizing support in the setting of muscle weakness. So if muscle weakness is not able, or if muscles aren't able to adequately be involved in an ankle strategy, by bracing at that level, you automatically translate the balance strategy up the chain to the hip. So that stabilizing support, either using the ankle foot orthosis or even the semi-rigid bracing can help in the setting of weak muscles. And bracing may also help with foot drop and improve balance by minimizing foot drop and then therefore reducing the risk of tripping or over environmental hazards. Assistive devices such as canes and walkers and walking sticks can also improve balance by increasing the sensory input through the hand. I'm sure many of you have experienced improved balance or stability when all you do is just touch a surface with the fingertip or run your hand along the wall when you're walking. Basically, when you're doing that, you're giving, I guess I sometimes consider it a fourth input into the brain about sensation, and that's coming through the hand versus coming through your feet. So you're providing the central nervous system with more information about your position in space when you have sensory information going through your hand. And that's really what things like canes and walking sticks do. They really just add sensory input. They can also widen the base of support, but walkers tend to widen that base of support more, as you can imagine with the four corners. You increase that base of support, which then will increase a person's limit of stability and how far they can reach. So when to use these things? Because I think that's a question that I address very commonly in clinic. Well, but I don't need it around my house, or I don't want to start using it. And I really say that it may not be something that you need all the time, but with the motor and sensory involvement that occurs with CMT, I often think that walking becomes a very cognitive task. It's a task that you have to be thinking about every step you take. You have to be aware of the surfaces that you're walking on, and you're constantly using your cognition to override and to think about your movement. Whereas walking from the time that we were very little was very much an automatic activity. It becomes much more of a cognitive activity. So I often recommend that people use assistive devices in situations where they may be distracted. So if you think about walking around the state fair or walking in situations where you're going to be looking around and looking in the environment, so your visual system is distracted by other things and you're not concentrating solely on your balance, an assistive device such as a cane or a walking stick may just provide enough additional sensory information to help you compensate for not using that 100% visual information or for being distracted a little bit from a cognitive standpoint as well. Those are situations where I sometimes would recommend the use of a cane or a walking stick in places that you would be distracted or in places that you would be using your visual system for other things, so that the additional sensory input might be helpful. I also sometimes will recommend using assistive devices when you, and this goes back to kind of balance confidence, when you make a decision that you don't want to go do something because you're concerned about your balance. That may be a time where an assistive device may be appropriate, because I would much rather have an individual go for a walk in the park using a walker than choosing to sit on their couch, because that inactivity of being on the couch is not good for our health. Whereas walking, even with the assistive device of a walker, gets you up and moving. And so when we're considering not doing something because of our balance is another time that assistive devices may be considered. I think of it as far as if someone's choosing to reduce their activity because of the fear of falling, then we end up with decreased strength and decreased confidence, which just cycles back around to reduced activity, and it becomes a bit of a vicious cycle. And so it's really important to try to maintain activity level and think about using assistive devices to help support that. Wheelchairs and scooters may also be appropriate, so either when the surface area or uneven ground is being walked on, or for longer distances and fatigue is an issue. But the thing that I would just suggest is that remember that we don't want to, or we want to avoid inactivity. So when you get to your destination is to try to spend some time standing if you're able, if you've used a assistive device to get to your destination. Environmental considerations, these are overall general good practice for safety and modifying the environment to prevent falling and to prevent loss of balance. So using non-skid surfaces, especially in the bathroom or in the tub. If you live in an area like I do up here in the Northeast, and you have stairs that go outdoors, is to consider using some of the paint that has the grit in it to make the stair surfaces a little bit more less slip or more slip resistant, I guess I would say. Using lights. So again, using lights allows you to use your visual sense a lot better. So putting night lights in or using flashlights when you go out to the car at night really can help enhance the visual system's contribution to balance. Grab bars and handrails. Again, you're looking at increasing the sensory input from the hands. So specifically having grab bars in the bathtub or and handrails on stairs are really important. Supportive footwear is important as well. So really, what is supportive footwear? Well, it's footwear that's going to fit properly, which I know is a challenge in individuals with CMT often. But you also want to have, want it to fit as properly as you can, and you want it to have non-skid soles, which will help. So those are some of the interventions that we can use to address the extrinsic factors of balance. I tried to summarize some of the questions and tried to group them together to give a little bit of input as far as answering some of the questions that you guys asked. So general exercise recommendations. Obviously, like I said, is always contact your physician prior to engaging in new activities. Make sure that the rest of your health systems are okay to be engaging in physical activity and exercise. So the goals of exercise are really to minimize what I would consider as disuse atrophy. So we know that there is weakness in individuals with CMT because of a disease process. But we can also have weakness because of inactivity or disuse of muscles. So we call that disuse weakness. We also, unfortunately, have age-related weakness. So weakness that occurs just because we're getting older. And in women, I know that we lose a half a kilogram to a kilogram of muscle mass a year after the age of 30, just based on hormonal and age-related changes. So with exercise and physical activity and strengthening activities specifically, we're really looking to minimize that disuse weakness and that age-related weakness versus trying to strengthen muscles that have been affected by the disease process. Again, these need to be individualized to your activity level, your daily routine, your amount of strength, and your activities. It may be beneficial to focus on more proximal muscles, muscles that are closer to the trunk. These are muscles that are not, they may be affected by CMT, but as many individuals have more distal weakness or muscles at the ankle joint that are weak, if we can try to help individuals stay strong basically between the thighs and the chest, so that middle core area That helps with a lot of those balance strategies that we talked about. So maybe focusing on strengthening more of those proximal muscles. You want to focus on muscles that are able to move against gravity. So that may say if you're wearing ankle-foot orthoses and you want to go to the gym but you feel like you're not getting full benefit from using the equipment because you're using your braces, well, you probably have braces because those muscles have gotten weak enough that they need external support. And so focusing on those muscles may not be the best bang for your buck while you're doing some specific exercise. However, you may want to obviously stretch those areas, so spending time doing flexibility of the ankle, and also just you can take the braces off and just move the ankle in all planes that is able to move, even with gravity eliminated. And spend your time while you're engaging in specific physical activity on those muscles that are able to move against gravity, that are strong enough to do those things. Other questions? Using different pieces of exercise equipment. So there are often times that I will recommend using a bike over bike or elliptical over treadmill and walking, and that really becomes because treadmills and walking are often challenging to people with CMT because there's time spent with the foot off the ground. Whereas using a bike or an elliptical, the foot is always in contact with the surface, and it decreases the risk for rolled ankles or sprained ankles because that foot is always in contact with the surface. Recumbent bike over stationary bike. Well, the thing that I would say is if you're able to tolerate an upright stationary bike, I think that helps because the trunk has to maintain stability, whereas if you're sitting in a recumbent bike, you have support of the trunk, and those muscles are not being activated. That being said, it may be too much for your body to use an upright stationary bike, and it may be adequate for you to use a recumbent bike. So again, these are things that are so individualized, and I can't specifically say one thing over another. I can only just tell you the rationale behind why I would suggest an upright bike, and that would be because your trunk muscles have to work when you're sitting on an upright bike. But that, again, may not be appropriate for you for your situation. Really important to balance activity level and fatigue. So some days all you can do is get through the day, and I think we all can appreciate that. You as an individual have to learn what works for your body, and you exercise on days that you aren't already tapped out. You know, when you have some downtime and that you can take on some extra physical activity. That being said, know that new activity levels are going to increase fatigue. It takes time for the body to adjust to that new activity level. We know that the powerhouses in cells, so mitochondria that are in cells, increase with physical activity, and they have a response to activity or physical exercise that they increase over time. So in that initial period, you may experience increased fatigue, but I would ask to hold on there for, you know, probably about a 3-month period of a new activity to see if your body can adapt to it. Too much activity. How much is too much? The guidelines that I tend to give individuals is that after a day of activity, you should be able to go to sleep at night, have a good sleep, and feel fairly refreshed the next day. You may still have some muscle soreness if it's a new activity, but that should disappear over the 48-hour time period. But if you don't feel refreshed, you can kind of gauge in your own head that whatever you did the day before may have been a little bit too much, and try to cut back a little bit. So again, like I said, this is a very individual thing. You need to learn your own body and what works for your own body and balance that activity level with fatigue. Stretching, I think I went over the importance of maintaining flexibility of the joints. And the other thing that I would say as far as general exercise recommendation is use each other for resources. I've been so inspired and learned a lot from watching the posts on the CMT athletes Facebook page, and that's everyone from individuals who are just diagnosed and just trying to, figure out what to do about physical activity, to people who are elite hand cyclists, to people who are triathlons. It is the whole range of individuals that are out there doing physical activity and attempting to use exercise to help treat the CMT. And like I said, I've been really inspired and have learned a lot by watching these posts, so I'd recommend all of you spending some time looking at that Facebook page if you are on the internet and on Facebook as well. So is physical therapy beneficial? Well, I think the thing that I would say is, obviously as a physical therapist I feel it is, but physical therapists can perform that baseline evaluation of strength and function. And we can make recommendations regarding activity and exercise levels and bracing and assistive devices, environmental modifications and energy conservation. There's lots of things that we can make recommendations about, and we can work within the healthcare team, working with the orthotist or working with your neurologist to help all of us together to help as a team approach to really what I consider the goals of care are really to maintain that optimal health, and that includes trying to work on diet and nutrition and working to maintain an optimal weight so that your body is functioning at its optimal level. We try to prevent or delay secondary complications, so that's the stretching, trying to maintain joint range of motion and things like that. Maximizing functional abilities, and is that using assistive devices and using bracing to help maximize an individual's functional abilities. And then really looking to obviously maintain or improve an individual's quality of life. One other question that came in is assistive devices, and I think I tried to discuss this during the talk. Are they a help or are they a hinder? And I guess the thing that I would say is a lot of times that they'll help improve the sensory input, which is important for our balance. It can offer an increased base of support, and when to use them, really using them in situations where your other sensory systems might not be working optimally, or that you may be distracted from a cognitive standpoint. When you choose, when you're considering not participating in an activity because you're afraid of your fear of falling, and those may be times to think about using assistive devices to help you. That being said, of course, if you become a person that can only walk with your cane, then it can sometimes it can not hinder you. I wouldn't use that word. It just may make you more reliable on it on an overall basis, and that may just be where you're at that time period. And I think that that's okay. And in that situation, I would consider that a help as well. So I hope I've addressed that assistive device question adequately, but please let me know if I can answer any other questions. And that's all I really had for formal presentation. I'd be happy to take any questions now, any additional questions that people have.
Well, thanks very much, Katie. That was completely informative and interesting, and I hope useful for all of our attendees. We've had half a dozen questions come in during the presentation, and I'm sure some other folks are thinking of new questions now. If you are, please type them into the questions window in the dashboard window that you see on your screen, and I will try to pass them along to Katie. The first question is, can chiropractic treatments help with alignment?
So can chiropractic treatments help with alignment? I think it depends on what the issue is with alignment. Is it just, are we talking spine alignment? Are we talking ankle alignment? I'm not specifically certain on that. I do know that I can tell you that I think it's always important to keep all healthcare practitioners as possibilities for assisting you in treatment. So if that includes getting an evaluation by a chiropractor, that would be fine as well. I would also say that physical therapists are able to perform a lot of the mobilizations and manipulations that chiropractors are able to do and helping with alignment, I would say mainly of the spine, but occasionally people use these things for other joints as well.
Okay. Second question is, to find a physical therapist for CMT, would the category be neurological or musculoskeletal?
Under the Find a PT, I think you can go in several different directions. I think the certified specialists in any of the areas are great because they show a different level of commitment to the profession and to their education by obtaining advanced certification. And I think, again, it's just finding the person who will learn about CMT. So neurological certified specialists have a background in neurology and probably have more exposure to CMT than other certified specialists. That being said, I think other certified specialists can be open and willing to learn and understand the issues about CMT and can be excellent providers of care as well.
Here's a question that I think is probably outside your area of expertise, but I'll mention it. We've had a couple of questions about finding PTs in Canada, or actually practitioners who know about CMT in Canada. Are you familiar at all with how to find them?
I do not know. I don't know if the Canadian Physical Therapy Association has a similar Find a PT link or not. I guess the biggest recommendation I would say is to find a neuromuscular disease center. I know I'm not familiar with the west coast of Canada as well, but there are places in London, Ontario that see a fair amount of individuals with neuromuscular diseases, and in those type of settings they may have a better idea of physical therapists that are that have been working with individuals with neuromuscular conditions, including CMT.
Thank you. The next question is, how about zero gravity machines like the Atera G? Do you have any comments on that?
I am not real familiar with those type of pieces of equipment.
Okay. You haven't seen anything in the literature or talked to anybody that may have used them for treatment?
No, I haven't seen anything in the literature.
Okay. Next question is, I'm okay walking, but when I stop, I'm unable to stand for more than 5 minutes, and then my balance and leg strength give out. Any suggestions?
The thoughts that I would have behind something like that happening is when you're walking, you are using different muscles, and in the situation where muscles are activated and then they relax, and they're activated and relax because of the walking cycle. Whereas when you're standing, those muscles are more, certain muscles are needed more for like a postural type situation where they are turned on all the time, and sometimes fatigue will set in with those muscles. Definitely trying to change positions will help. Sometimes flexing and straightening the knees will help a little bit because they put different tensions on the calf muscles. And then situations where you are able to either put a hand on an external environment, either a wall or a table or the back of a chair, may help just save you some time or buy you some time in standing in a standing position.
All right. Another question is, would it help to have hammer toes straightened by surgery?
I think not necessarily something I specifically address from a physical therapy standpoint. I would have to ask the individual what are there things that are impacting function by having hammer toes. So is it sneakers aren't fitting or shoes aren't fitting, or there's pain in different positions of the feet? So there are probably a lot of follow-up questions to be able to decide whether or not surgical intervention would or would not be helpful.
Okay. Next question is, I have bursitis and have been given exercises to help. However, nothing has helped. I've not been given an answer as far as whether it has to do with my CMT. The band exercises are very difficult for me, and I'm in pain trying to do them. Any suggestions?
Do we know where the bursitis is located?
No, the person doesn't specify. That's from Linda Westmoreland. If Linda, you'd like to write in and clarify the question, I can restate it to Katie. Why don't we go to another question and see if we get some more information from Linda. Next question is, sometimes when I'm standing, all of a sudden I feel a little frozen. My legs don't want to move. I have to think very hard to tell them to move. Is this normal for CMT?
It's not a complaint that I've heard a lot from individuals with CMT. I do think that the muscles can fatigue, and again, using that more because of the way that the sensory information is coming into the brain, if that the way it's being processed within the brain is skewing the messages going back out and making that whole physiology process move slowly because the conduction on the nerve moves slowly. So that may just be your mind is saying I'm ready to go, but the messages between the environment in the brain and back out to the muscles are moving slower than your mental capacity of wanting to just move could be. I don't have a great answer for that, but I do know that that process of translating information to and from the brain can be slowed by nerve issues with CMT.
All right. Linda wrote in and said that her bursitis was in her upper leg and hip. And again, her question was, nothing's helped, and she hasn't been given any answers as to whether the bursitis has anything to do with CMT.
I don't think necessarily that the bursitis is a direct has a direct relationship with CMT, but I can definitely think that it may have an indirect relationship to CMT. So if there are tight muscles, so for instance the hip flexors, in work that Gita Ramduri has done, the hip flexors are often tight and overused, whereas the hip extensors and hip abductors may not be. So what you're looking at is a muscular imbalance between the different muscles around the hip joint, and because of that muscular imbalance, there may be stress placed on different points of the joint, creating conditions that would be conducive to bursitis. My recommendation would definitely if you're having difficulty with the exercises, is to revisit your healthcare team and be able to have further discussions about what's happening and trying to determine the cause of the bursitis.
That's a good point to make. I mean, you can make recommendations and you can speculate based on a little bit of information that people provide in their questions, but going to a PT or going to your doctor to have them examine you and get much deeper into the symptoms and things that are affecting you is a much better approach than trying to reach any conclusions in this presentation.
Absolutely. I can't stress that enough.
Next question is, you made a recommendation for cardio of 30 minutes 5 times a week. And attendee K writes in and says, would 3 sessions of 1 hour each be just as beneficial?
I have no problem with that type of recommendation. They do say the spreading it over the course of the week is the most beneficial, but also, you know what, accomplishing 3 hours of of physical activity is great, and I would fully support that.
Next question is, what might cause loss of strength at the hips with CMT? I've been unable to strengthen the hips with exercise, and this is a real factor in my ability to walk.
Did you state that the person was unable to strengthen their hips with exercise?
Yeah, he says I've been unable to strengthen the hips with exercise, and it's a real factor in his ability to walk.
Well, we know that the nerve involvement moves from the distal area to the more proximal area. So, again, I would obviously recommend an evaluation by your healthcare team to sort out what's happening at the hip level. But we do know that CMT can be progressive depending on the length of time that you have had involvement and the progression of the disease itself. It's not out of the realm of possibilities of having hip involvement, but again, I would refer you to your healthcare team to further evaluate that.
I have a couple of questions related to hands. So the first one is, I have some muscle fasciculation at the base of my thumb when I hold my thumb in a certain way. So do I still exercise when pressure on nerves causes that? I'm prone to cramping and spasms that pull my big toes straight up. It makes me fearful when I exercise, but I do it anyway. I retired recently, and those improved and have largely disappeared. I am exercising sporadically on days I don't mow the lawn or snowblow. And another question was, where would one find some hand exercises for CMT?
Specifically, hand exercises and hand concerns with CMT, while I have a peripheral knowledge and information about hands specifically, I do know that there are, I think, 2 occupational therapists on the advisory board, and I would recommend contacting them for specific questions about hand issues and hand strengthening and hand positioning type situations. I think they would probably be the experts in answering those questions.
Okay. Next question is, do you think vitamins like flexamine are helpful to CMT patients?
Again, that's probably out of the scope of my physical therapy practice to answer.
Okay. Next question is, could you repeat what you said about doing too much exercise? Is it possible that's going to speed up the progression of CMT? And another listener reported that their physical therapist said that not all people benefit from physical therapy.
So the first question, there continues to be inconclusive evidence, I guess I would have to say, in the literature about what you're saying is basically overwork weakness. So if we work something too hard or too much, that we actually make the condition worse. In most neuromuscular diseases, they've said that moderate intensity exercise in these slowly progressive conditions is safe. And the most recent study that I referred to, and I don't have the citation right here, is the 271 individuals that they looked at over time, and really concluded that overwork weakness is not something to be concerned with in CMT, and that physical activity is beneficial and should be encouraged. The other question about physical therapy, can you repeat that again?
Oh, just a report from one of the listeners that their physical therapist had said that not everybody benefits from physical therapy.
Well, unfortunately, I feel that we have a lot to offer individuals. I think the thing with when working with individuals with chronic conditions, which is what I do every day, is helping individuals is maybe not making things all better and fixing them, but helping individuals manage their condition and manage the things that they're able to do, and like I said, maintain optimal health, maintain functional abilities, and maintain quality of life. And to that extent, I feel that physical therapists do have a lot to offer, but I do have to think that there are probably physical therapists that aren't used to working with individuals that have chronic progressive disorders, and the goals of when dealing with chronic progressive disorders are very different than dealing with someone who may have a sports injury that are able to recoup and recover and get back to their regular baseline.
Makes sense. We have about 4 more questions. Is the use of Epsom salts helpful? Also, any recommendations for hot tubs? Would salt water be helpful?
That is an area that I can't say that I have any information or knowledge about.
Okay. Next question, is resistance exercise better for a person with myotonic dystrophy rather than free weights?
Can you ask that question again?
Yes. Is resistance therapy perhaps better for a person with myotonic dystrophy than using free weights?
So free weights are a form of resistive exercise. I think any sort of resistance is okay. Again, I think we have to be mindful in individuals who may have weakness that proper alignment of the joint and the proper form of the exercises is really of the utmost importance, regardless of what kind of resistance is being used. So resistance of exercise bands, resistance of free weights, resistance of exercise machines, or resistance of gravity can all be effective means of using resistance, but I think it really, what determines that is the safety and the ability of the individual to use proper form and proper alignment of joints.
Thank you. Here's a question. Are the electric wave machines put on the legs to stimulate nerves a good thing?
Again, because we haven't actually touched on this, because CMT is actually a condition of the nerve versus the muscle, which is a lot of times what that electric stimulation is used for, is to help send that message from the nerve to the muscle. And really, because CMT is a problem of the nerve, I don't think that the use of electric stimulation is beneficial. Again, I don't think there's been 100% conclusive evidence in the literature, because obviously if you use some sort of electric stimulation device that just makes the muscle contract, you can change the physique of the muscle, but the actual function of the muscle, because the pathway from the nerve to the muscle is disrupted, there's no real strength or function benefits from it. You just get the physique benefit from it, if that makes sense.
Yeah, which may be what some people are going for if they're having a atrophy of the muscle that's becoming apparent.
Right.
Another question, hip dysplasia is sometimes present in CMT patients. Persons may want to verify they aren't dealing with this and possibly arthritis in hip joints. I'm 45 and have had both hips replaced due to early onset arthritis as a result of dysplasia. I not really a question, just a comment I think that maybe you might want to comment on.
Sure. I mean, definitely. I think with individuals who are having hip problems, is following up with orthopedic care to, as part of the team that is providing care to individuals with CMT, is always a good idea, and can give some, orthopedics can offer some additional information and input to the team approach.
Getting close to the end here. This question is, I have type 2 CMT, which has resulted in stiff toes, which I'm unable to bend, with attendant pain, numbness, and loss of balance. Exercise is impossible without setting off these symptoms, and I don't know what I can do.
That's a challenging one for me to answer directly. I would definitely recommend consulting with the healthcare team to help manage that, to be able to best manage it at least.
All right. How does one establish a healthcare team when not many professionals know anything about CMT, I live in the Philadelphia area, and my neurologist at Penn only really deals with CMT genetics. I wonder how many people with CMT have also wonder how many people with CMT have coexisting back problems due to postural issues like I do.
There definitely is a subpopulation of individuals with CMT who do have some involvement of the back, often in the form of scoliosis. And so that can again be looked at by members of the healthcare team, probably most often orthopedics or physical therapists. As far as finding healthcare providers, in Philadelphia, I am fairly certain that the occupational therapist Tim Estolo is still at CHOP, and he is a person who is on the advisory board for the CMTA as well, and he would be able to probably help you find individuals in Philadelphia area that are comfortable and able to help with treatment of CMT, just because he is involved in that condition himself as well.
Okay. The final question has just a request to repeat the link I think you provided for referencing PT guidelines.
So the physical therapy, physical activity exercise guidelines?
I think so. I think he said that he believes it started with Health PA or PT guidelines.
Yep. Sure. So it's www.health.gov/PA guidelines/guidelines.
Great. Now I'd like to remind everybody that the presentation will be posted on the cmtausa.org website, so you can pick up that link there if you missed it. And but that posting probably won't happen for a week or so. Very final question is, would a person with myotonic dystrophy perhaps benefit from a higher protein diet? Is this within your area of expertise at all, Katie? If not, feel free to pass.
I think the thing that I would say is that if people, I would say just overall balanced nutrition is important. If people are looking at changing their nutritional intake for weight loss or things like that, the thing that I would say is to maintain protein levels in their nutrition. Protein is not something you want to cut out of the diet. I don't think necessarily a high protein diet has been shown to be advantageous in any sort of literature or research, but I guess our feeling is that in people who are looking to restrict calories is to not restrict it by cutting protein.
Great. Well, I'd like to thank you, Katie, for the very excellent webinar presentation that you've provided for us, and we've gotten tons and tons of comments from people saying that it was really useful for them, and they thank you profusely for taking the time and effort to prepare the information and present it to us this morning. I'd like to remind everybody again that this presentation will be available in about a week at cmtausa.org, where you can hear the presentation, see the slides, and perhaps a little bit later be able to read a transcript of the presentation. The next CMTA webinar will be presented on August 28th. That's a Thursday, and it'll be at 12 o'clock Eastern Time, and it features Pat Livney, who's the CEO and head of CMTA, who will give a up-to-date report on the status of our very exciting STAR, S-T-A-R, program or research project that's making some very substantial progress in determining a treatment and perhaps even a cure for at least CMTA 1A as well as various other variants of CMT. Is there anything else you'd like to say, Katie, before I sign off on this webinar?
I would just again thank the CMTA for having me, and to let people know that you know, I am here as a resource, and I'm happy to answer questions and help people find resources in their local environment or local living situation if needed and necessary. Thank you.